5. Okay. Atkins, Paris. You here? Not here? Bond. Good morning. Aaron Brown. Morning. Jasmine. Morning. Ferris. Blake. Mary. Morning. Harwick. I just saw she's here. Hodge. Humphrey. Morning. Madison. Morning. Taylor. Mathis. Nest. Morning. Oswald. Michael. Morning. Addison. Teddy. Ray. Morning. Jonathan. Morning. Jalen Smith. Morning. Latham Smith. Morning. Easton. Taylor. Madison Webster. Morning. Ellie. I hear anybody I miss? All righty. All righty, we are in week 12. 2 weeks left, believe it or not. 2 weeks, you guys will be done. First time freshmen, no longer. You'll be moving on. Okay, week 12. All right, so we're going into chapter 11. I'm gonna preview that, and then I'm gonna go into the assignment that you guys have to do. The major research project that I have for you. Okay, so we had attendance. I took that chapter overview. So I'm gonna do that first. Then I'm gonna go into the healthy family research lecture. It's a PowerPoint. Give you the location where you can find the worksheet that you will use, and show you an example of how I want that worksheet completed. Okay. All right. So as we go into chapter 11, chronic disease. Okay. Before I gave the assignments, and then I gave the lecture that kind of went with the assignment. This time I'm giving the lecture before I give the assignments, and you will understand why as you go through. Okay, so in this assignment, in this chapter here, chapter 11, chronic diseases, overview. All right, in this chapter, you will identify the major types of cardiovascular disease, cancer, and diabetes. Something you will need to know. Part of the assignment that you will have to do is you will have to research your family to see if some of these health issues are within your family. All right, in this chapter, you will be able to assess your personal risk factors for these chronic disease. Now, again, the assignment that you guys are going to have to do over the Thanksgiving break is interview your family, meaning your mother, your pops, your fathers, they're around. So again, so you will have the ability to assess your personal risk factors for these chronic disease. You need to know what they are and where they're coming from. Okay. In this chapter, you understand the describe and screening, diagnose, and the treatment option. If you don't know what they are, if you don't know they exist, what the purpose of understanding and describing the diagnosis. And you will know what they are and if they exist after you complete your assignment, your project. Okay? In this chapter, plan steps to reduce your risk of these diseases. Key thing, plan as you will, just like the assignment for as researching or sharing what you eat for 2 weeks, you need to know the information so you can plan. Just with this assignment, as you begin to do your research with your family, that is your first plan or your attack so you can generate the steps to reduce your risk of these diseases. You gotta know what they are. Again, it's like with your meals for 7 days. You can go to a piece of paper now and look at Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. On breakfast, I ate this. On lunch, I did this. I drank this, whatever. Now you have that. After this assignment here, you will have this that's associated with the cardiovascular, that was associated with health issue, so you can put together the steps to help you reduce these diseases if you have them. Okay? All right, so the assignment. Over the Thanksgiving break, and I chose to do it because you now will spend a little bit more time with your family versus what you've been spending while you've been in school. All right, the 2 days, we got here Wednesday, Thursday, Friday, and then over the weekend where you have the opportunity to sit down with your parents to do this assignment, okay? The Family Health Research Assignment. All right, so as you get home and as you talk to your mom and dad, and as they ask the question, how are you doing? Oh, I'm great. What have you learned up there at college? Well, that's the icebreaker. It's like, oh, wow, this is the time. Now I can say, okay, this is what I learned, and this is what I need you for. Mom or dad, whoever you're talking to. Well, Professor Johnson are in a class called Foundational Wellness. I need to interview you. I'm like, what? Yes, you need to interview whoever it is that you're going to talk to. All right, and this is the assignment. And it's very important that you do this. All right, now, as you begin to share more intelligently, they're going to be wondering why. And so you will be able to recite something similar to this. You're going to say, well, knowing my family health history can help me, one, and your family have a healthy lifestyle. I'm like, whoa, that is true. You know, when referring to you and when I'm referring to your family, I'm referring to your children. You know, people beyond you, you know, knowing this information. So as mom and dad ask, why do you need this information that you're going to ask them for? There you go, Coach Johnson, I've shared with you. All right, tracing the illness suffered by your parents, if there are any at this point in time. There may not be, but particularly your grandparents and other relatives can help your doctor predict within you disorders to which you may be at risk and take action to keep you and your family healthy. When I'm referring to you and then I say your family, I am hoping that I am challenging you to be prepared as you move forward and start having your own children. Okay, that is, you need to know these things. All right, so again, as you sit down with your parents and you talk to them, and again, you ask them and you share with them, Mom, Dad, that's a very important assignment. That's 100 points that I don't need because I'm already at A because I've been doing things, but it's 100 points that's gonna keep me at that level, you know, because I don't want to drop down, make y'all proud of it. You know, so I need this assignment here to be completed. All right, so what you will learn from this assignment, all right, and I don't want you guys to be in the situation that I was in. And the situation that I was in at 50 years of age, when I went to a doctor, and the doctor said, you have high blood pressure. And he asking me, do you know if your family, anybody in your family member having high blood pressure? Well, I'm at 50, and I'm like, no, I don't know. So once I got out of there and went home, I was talking to my mother, I said, Mom, the doctor asked me a question that I couldn't answer. He asked me if there any family member having high blood pressure. She said to me, well, I've been having high blood pressure since I was 25 years old. I said, Mom, that would have been a nice piece of information that you should have shared with me whenever, you know, and then when the doctor asked me that question, I would have said, yes, someone had it. You know, I don't want you guys to be in that position. I want you to know. Anybody here, in here right now, that have been to a doctor without their parents? Okay, when you went, was it your first time registering at this particular place? It wasn't the first time? When you went, did you have to fill out a questionnaire form? On that questionnaire form, was it on there what may be in some of your family history as far as anything? It was on that questionnaire form. Were you able to, at that time, answer the question appropriately? Good. If you were, excellent. Most of us get to that point at 19 and 20, we don't know. All right. One thing that I have from learning from my own experience is my 25, my 33, and my 35, and my 27, they knew about my health issue as well as their mom's health issue while they was in their early 20s. Very important, okay? So what you will learn what is in your gene so you can better monitor your lifestyle. This is what you will learn. Very important. What you will learn after you finish, more about your family health history that you need to know. I cannot emphasize that enough. Something that you need to know as you continue to become an adult. You're young adults now, but full adults beyond that. You need to have this important health information to share with your child or children. You would need to have it. I will hope you will want them to know. Accurate information to share with your physician. Some of you have had the opportunity to fill out these health questionnaire and was able to provide accurate information because you talked to whoever gave it to you. All right, I want all of you to be in that place. The only way you can provide accurate information is you got to hear it from what I call the horse's mouth. Directly from your parents to you saying, this is what I have in me. Okay, accurate information. This is what you would learn once you get through with the assignment. Now, one of you, can you tell me resources to have success with your health growth as it pertains to this assignment? What are your most important resources that you need to have? Can you tell me that, man? Parents, one of the most important resources, all right, that you need to have for this assignment. No textbook, but really your parents, your father, your mother, your grandparents. Your mother, father, grandparents, great-grandparents, if they are available to you, okay? If they are not, and you can ask one of them, if they know the information, then they should give you the information. Because as I tell you, that as things start way back here, we got our grandparents, great-grandparents. So way back here, great-grandparents. You step up, you have your grandparents. Then here you got your parents, and then here you are. Trust and believe as you start to understand about health issues. When it's back here, and it can travel, and it will travel, and it's gonna get to you. And then as you have children, it's coming there. Diabetes, 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 diabetes. It's gonna happen. The thing that you're gonna wanna do, and the thing that has happened in our lifetime is back here, when our great-grandparents was hit with diabetes, their lifespan was cut short, almost significantly. Here, medicine got better. Now we got diabetes at this age. This is great. This is grandparent. Lifespan improved because of medicine improved enough that we wasn't losing them as quick. Here, your parents' medicine continued to improve and evolved. So now we got diabetes. Yeah, we might lose a limb, but we still can survive a lot longer than back here. Now come to you guys, today, if you have the same disease, as one of the things that you start losing are limbs, all right, you can keep the limbs, providing you a word of information, providing you on the proper medication and seeing a doctor that will help you take care of this. Now you're doing some things, you're aware of this information. Now at this stage you got diabetes, same thing, but you're living longer. Trust and believe, as we transition here, you got your young people, that diabetes coming through the chain. Where you gonna share with them and you're gonna take care of yourself, it's still not gonna stop it. The chances of them getting it, they're gonna get it, but the medicine would have improved. You would have gave them information. They would have started talking to your young people, just like right now for you guys. You're now gonna start doing some things early because you're aware of the information, and the doctor gonna say, cut out this, whether it's sugar, these things that's cause diabetes, okay? So, here's a video I want you to listen to and concentrate with it, because the first line on this research project that I asked about is you. You are the top here. Not the great-grandparents, but you at the top. Now, right now, I'm pretty sure all of you in excellent health condition. All right, but when you listen to him, this doctor here, all right, he's gonna share some enlightening information that you guys may be going through at your age. And because you are having these issues, these are things that could be happening to you. All right, so it's a quick video. It's pretty good, pretty entertaining as he presents his information, and it's pretty quick.
Just by looking at you, I can tell what's wrong with you. You want to look your best, and whenever you have any imperfection, you're quick to blame it on aging or stress, but really that's not all the signs that something is wrong with your body. If your insides aren't healthy, that will show superficially. That's why when you come into my office, I look at you as a whole. What warning signs are appearing on you superficially that I can figure out to lead to a diagnosis? Before I spill the beans and explain to you everything that's going on, you need to understand how the body works. It works in a system, and it's made up of multiple components. When one of those components doesn't work, a lot of times that can show signs on your physical appearance. If one part isn't working, another part of the body compensates. That's the way your body maintains something what we call homeostasis, a balance of what's normal. Wait, one more thing before we start. It's important to know that while I'm giving you a lot of physical appearance signs, it doesn't mean that you have the disease if you have one of these. All it means is that you need to go to your doctor and have a conversation. Something you should be doing anyway if you've been watching my videos. Boom, these are the top physical signs that tell me something else is going on inside your body. Facial flush or rosy cheeks. Do you feel like your face looks a little too red? I'm not talking about the time when you get sunburned or when your crush looks at you. Hey girl, you may have a medical condition called rosacea. Rosacea is a fairly common skin problem with 14 million people living with the issue in the United States today. It's not something you should get really concerned about thinking it's a danger to your health, but it's a simple, benign condition that can be treated by your doctor. Wait. One more thing about facial flush. If you're part of the Asian population, you may suffer from something called Asian flush. That's what happens when you drink alcohol, but because you're deficient in the enzyme acetaldehyde dehydrogenase, yeah, that's a mouthful. You may have a reaction because you can't clear the alcohol properly. You may think you have a thin chin. You may think you have a thick neck. You may think it's just a cosmetic problem, not that big of a deal. I think it's a serious risk factor for an illness called sleep apnea, which can predispose you to so many bad illnesses, including stroke, heart disease, high blood pressure. When you have sleep apnea, there's actually moments in the night where your airway completely closes. Whether it's because it's too small or too big, it closes. And when that happens, it ruins the quality of your sleep. We've all heard our partners snore at night, or wake up in the middle of the night because their breathing wasn't right. That's sleep apnea. One of the best lifestyle changes you can make for sleep apnea is to lose weight. Unwanted body hair. Ladies, this is mostly for you. If you start growing hair where you've never had hair before, it doesn't mean you should pay a visit to your spa, but it does mean you should pay a visit to your doctor. Why? Because that actually has a medical word behind it. It's called hirsutism. And what that means is you started growing hair in a place where men usually grow hair. This could be due to a hormonal problem, one of the most common being PCOS, which is polycystic ovarian syndrome. When you pair hirsutism plus abnormal periods, that's highly suspicious for PCOS. Hey man, you got stanky breath, bro? If you have bad breath or what's medically known as halitosis, it could be a sign of acid reflux. During acid reflux, the stomach contents, including food, acid, all get pushed up into your esophagus and create this nasty smell that you may notice when you think you have bad breath. A lot of people think they'll solve this problem by brushing your teeth more, but that's not the solution. The solution is to go see your doctor. Some say the eyes are the window to the soul, but what I say, the nails are the window to your health. When a patient comes into my office and I'm doing a physical exam, I pay extra attention to the nails. The nails give me a lot of information on what's going on inside your body and tip me off to some illnesses I should be on the lookout for. If you have clubbing of the fingers, that could point to a chronic respiratory infection. If you have spooning of your nails, that could point to a chronic anemia process. Some of you may worry about white marks or lines on your nails, and generally that's not a problem. But if you do have two lines running parallel horizontally across your nail, that could be something called Muehr's lines and representative of kidney or liver issues. Some of you may find dents or ridges in your nails, and generally that's not something you should be concerned about. If that does occur with some weird symptoms at the same time, that's definitely something I want to hear about and could point to a more serious autoimmune issue. Do you guys remember what the body's largest organ is?
No! No!
Skin. First things first, you know you have that little pimple, that little scratch that never seems to heal? To you, that may not be of any importance, but to me, it's incredibly important. If you have a non-healing wound of the face, it's squamous cell carcinoma until my tests prove otherwise. Also, of utmost importance to skin are moles. No, not this type of mole.
Mole! Bloody mole!
Yeah, that's the mole I'm talking about. Most of the time, moles are completely harmless and benign. However, sometimes they may represent a serious form of skin cancer. The way doctors make this distinction is using the A, B, C, D, E classification system along with dermoscopy. When you're younger, it's not abnormal to form new moles. However, as you age in your 50s and 60s, if you're still developing new moles, that could be a cause for concern and cause me to investigate further. Hair. It's perfectly normal to see a few strands in the shower, but if your shower drain looks like a baby rodent, there might be something else going on. Excessive hair loss can be caused by an overactive or underactive thyroid, or something like anemia. So when a patient walks into my office, I pay extra attention to what's going on in their scalp. However, have no fear. A lot of these issues can be diagnosed by a simple blood test. Also, it's important to remember that you're able to lose up to 100 strands of hair per day, and that's totally acceptable. The eyes will give you a lot of information. If you look at the color of the eye, if there's something off, it's not perfectly white, a lot of times you'll see some yellowing of the eyes, and that has a medical name, it's called jaundice. That occurs when there's something wrong with your liver or your gallbladder. I can also look below your eye and get some extra information. Things like redness or bags can represent something called allergic shiners, which is a very common symptom of people who suffer with allergies. Springtime, fall time, very common. If you don't sleep well, if you eat high sodium foods, if you're dehydrated, the appearance of your eyes is going to appear fatigued, heavy, sad, and it's not going to be a pretty sight. You know what they say about big feet, right?
Yeah, no.
It's important to make sure that they're not just swollen. That could represent a wide variety of medical issues. Things like congestive heart failure, circulation issues, lung issues, autoimmune things like arthritis. All of those can lead your legs to balloon up. But if you have some mild swelling at the end of a long day of being on your feet, that's something called dependent edema, and likely nothing to worry about. A lot of these signs I pointed out may seem like superficial concerns, but they truly tell me a whole story of what's going on inside your body. Never be afraid to tell your doctor if something doesn't feel right, look right, or even smell right. If you have any questions in the meanwhile, drop me a comment down below, we'll have a conversation and figure out what's going on. Otherwise, make sure to hit subscribe and share this channel with your friends and family. Those people over there are a little weird. Oh wait, that's me. The food that's supposed to be in your belly along with the acid gets regurgitated back into your esophagus, which creates that nasty smell you hear. You will see.
Okay, so if you want to, Dr. Mike at this YouTube.com channel can give you, again, those brief, quick areas to look at for yourself. You know, if there's no issues there, there's no issues there. Because again, at the start of this here, as far as your health research, it starts with you. Okay, so now as you get home and as you sit down with whoever, and again, hopefully it's mom, hopefully it's dad, hopefully you can talk to your grandparents if they are around, you know, and ask these questions. All right, one of them may ask you and share with you, are you guys familiar with what they call the HIPAA laws? All right, is your teacher familiar with the HIPAA laws? So if this question is posed to you, you would say, well, Coach Johnson is familiar with it. He gave us a website that we can look at that says your health information, your rights, what your rights are. Okay, so generally, the HIPAA law said to Coach Johnson, and what you guys need to know is that when you talk to the individual and you ask for this health information, they are the gatekeeper. You're the gatekeeper for your information. You're the gatekeeper for your information. I'm the gatekeeper for my information. Okay, when my son or daughter or whoever talk to me and ask me about my health information, I can elect, I can choose to give this information. Once I choose to give this information, then I am consenting to give this information to this individual. So they can say, nope, I ain't gonna give it to you. Nope, I don't want Coach Johnson to know this information, and they gonna say it's because of the HIPAA laws. This is what they may bring up, and they may not. They may be just willing participant, enjoy the fact that you coming to them and asking about this information. Okay, so what I want you to assure them, the information will be used this way. Mom and Daddy, this is for me, for my health situation as I continue on. I have to give it to Coach Johnson so he can grade this assignment. What Coach Johnson is gonna do with it is he will grade it, he will look at the information, and he will discard it. The HIPAA laws tell Coach Johnson that if Coach Johnson decides to take Hardwick information and share it with Smith information and it become out that I did this, then I'm being sued and the university can be sued because now we're in violation of the HIPAA laws. It's a protection of your personal information to stay where it needs to stay. With you, with your doctor, or in that particular facility. All right? So, assure them that their information, the one or two health issue that's provided, will go from you. I'm previewing and I'm discarding, and it does not go while I'm sharing with my colleagues or any student. Okay? So that's the question. All right? So kind of on the screen here of knowing your rights. They can be pulled up. All right? But hopefully they are willing participant and understand it and will be okay with that. All right? Any questions? All right. So, the instruction. This will be on your health research assignment. All right. You will have this here questions as the icebreakers. When you sit down, you will ask, do you have any chronic illness such as heart disease, high blood pressure, high cholesterol, diabetes, or cancer? Now, before you get into this, if you go through chapter 11, they're gonna give you some more health issues that you can ask. I'm just giving you just a couple of them that you might wanna ask. All right, but you can write down some when you go into chapter 11 to ask. All right, one, this right here, do you smoke? Yeah, nay, you already know that, just a question. Have you had any other serious illness such as cancer or stroke? That's what you ask. They say, yeah, you ask what it was, they reveal, and I'm gonna share with you what you're gonna do with this information. How old were you when you developed these illnesses? Like I shared with my mother, she said she was 25. That would have been good information to know for myself. All right, how old? Hopefully they will reveal. Have you or your parents, I'm about the grandparents now, their parents, had any difficulty with any other health issue that's not mentioned on here? Cancer, stroke, high blood pressure, cholesterol, any other? Ask the question. You know, be mature about it. Be comfortable with asking the question. I'm telling you, they're gonna love you more. They're gonna be like, wow, you're learning something up there. And I appreciate it, because now you're gonna sit down and ask these questions. Although you will have these in front of you. All right, what type of medication are you currently taking? If they are on any medication. Now, just say, for example, you say, oh, Mom, Dad, are you currently taking any medication? They say, yeah, I'm taking a high blood pressure pill. Well, one of the questions you asked up there, is there any current issue? And they said, no. Well, then you get to the medication, they said, well, I'm taking a high blood pressure pill. Wait a minute, that must mean that what? They got high blood pressure. You know, so you still got the information that you need to have. And then when I tell you need to have it, you need to have it. Okay, what medication you are currently on? Okay, so this form here is in Blackboard course material. And when you go in there, Blackboard course material, and look up the Healthy Family Health Research, and it pulls up, you know how to drop down and open up. This is the form, the top part of the form. So the questions is on that form that I just went over. It's already right there as you start your conversation. So when you sit down with your mother or parents, you're gonna have the form in hand, and you're gonna have your pen or whatever you use to take the notes, okay? So you ain't gotta kind of think about it and, you know, guess to made or whatever. So this is the form, all right? So this is the top part, and this is the bottom part of the form, okay? So You put your class time on there as always, so it starts with you. You put your name up there, and then you work your way down to your parents. So this is your mother, this is her parents, this is father, this is his parents. Okay? So when all said and done with it, it would look something like this. All right? So as an example, I have me up there. I got health issue NA, then I put health issue high blood pressure. All I'm looking for is just a few words. You don't have to do a whole sentence, just a few words of what the health issues are or not. If they are not, none, NA. If high blood pressure, high blood pressure. Okay, so as I sat down with my mother, as I shared, Miss Johnson, high blood pressure, breast cancer, prostate cancer. Can my mother have prostate cancer? Raise your hand, one of them tell me. Come on, raise your hand for my book. Can a woman have prostate cancer? What is it? No. Female do not have prostate. So, as an example, I just put that there just for the sake of an example. But no. All right, so hopefully no one come up with that right there. So, as I talked to my mother, because her parents, I did not meet my grandparents on her side. All right, they was deceased by the time I was 2 years old. So I didn't get a chance to meet. However, my mother knew what their grandparents, her parents had. So as she shared with me, Mabel and Ted, cancer, high blood pressure, diabetes. Ted, diabetes, high cholesterol. And I just put in just the words, okay? As I talked to my father, who again, as I shared, he was deceased, but I just put this information down, Thomas, high blood pressure, high cholesterol, colon cancer. Came on down to my grandmother, Pam, breast cancer, Alzheimer, my grandfather, heart disease, kidney disease, and colon cancer. All right, so I want your form in completion to look like this. Not highlighted, but look like this with the simple words in them. Now, when you talk to them, if mother do not have any health issues, then she do not. That's okay. Just put NA in there. If dad at this point in time, right now, do not or wish to not share, just put NA. Hopefully as they get down and talk about their parents, maybe they can reveal some things to you because they should be of age that something is happening within them, the grandparents, if they still with us. All right, because there's some, I guess your parents probably around the 30 years of age or something, and they probably don't have any, and that's fine. But again, hopefully, because when I tell you that if this great-grandparents have something, you're gonna get it. And they may not right now, they're gonna get it. When I tell you that, and then it's coming to you, it's coming, all right? And then as we'll transition to your child or children, it will do it. I'm sure, all right? And the best thing is to be able to share with your physician and know this information early so you can start doing some things today, changing the lifestyle. So you want to be able to not catch it at 30, but hopefully be at 60 someplace, and then high blood pressure come in. Or at 65, way out here, and then you take your medication. Because when I tell you, when you get on these certain medications, you are on them for the rest of your life. I will have to take high blood pressure for the rest of my life. I will have to take some form of diabetes pill for the rest of my life. It is no joke. I just want you guys to be aware of it. And I'm sure your parents will want you to also. So, over the Thanksgiving break, have this intelligent adult conversation. Not just for the 100 points, but just for the sake of you and your offspring whenever that time comes. All right, any questions that's pertaining to this assignment? Okay, if you or anybody here is adopted, just put your information here, NA or whatever. Here, just write in adopted. I have no access to my parents. to be fine. You still will get your 100 points. If any of you not around any one of these parents, all right, and you cannot get the information, that's understandable. Just put NA. You know, I'm just gonna take it as what I said. You do not have access to it. However, if your mother, for example, you've been raised, know a little bit something about what dad had, ask for her to share, because it's more important for you. You know, if you have an uncle that's close related to you or close, that knows something about a side of a family that's not existing, ask during this break, because this is pertinent information. But if you just can't get it, put NA, okay? If you just can't get it, just put NA. You know, don't stress out. Make sure you know what you got going on, and make sure you can try to figure out something else with one of these two people, you know, if you can, you know, etc. It's very important, not just to me, but to you. Any questions? Okay. All right, so back to that there. I want you to good luck with your Healthy Goals research assignment. I want you to have a great Thanksgiving. Although we're coming back in here Monday, it'll be real short. We're gonna come in Monday and take the rolls, and I'll probably let you go. If you feel like it's a waste of time, all right? Well, we're gonna meet Monday. But at the end of this week, we do have a smart book assignment at the end of this week, or whenever you complete it. And we do have module 11 quiz, talk about the cardiovascular and those things I went over for Saturday, Sunday due, or as soon as you complete. Have fun with the chapter. Good luck as always. No questions? Be dismissed. I will see y'all Monday.